There's a mistake I see physicians make all the time when they decide to start a private practice. They jump straight into how to start, even before they've actually decided what kind of practice they want to build. And that decision will shape your schedule, your income, your patient relationships, and honestly, your quality of life. Hi, I'm Dr. Brittney Anderson. I'm a family medicine physician and private practice owner, and I help physicians go from idea to opening their own practice with clarity and with structure. In this episode today, I'm going to walk you through 3 common types of private practice models so that you can start thinking about which one actually fits your life and which ones fit the goal and which one fits the goal that you have for your future private practice. The first model that I want to talk about is the traditional insurance-based model. Now, this is the one that most of us are familiar with. It's what we saw in our training, in our residency. It's where you see patients. They may have a copay or deductible or co-insurance, but you see them, you bill their insurance, and you get paid for the visit. Now, there are definitely some advantages with insurance-based practice. You have a larger patient pool. Patients are already familiar with how insurance works, and there's a level of predictability and volume. But there are some trade-offs. Reimbursement per visit is often a little bit lower from insurance. There's administrative work like billing, prior authorizations, and denials. And because you typically have to see more patients, there's a little bit less control over time. There are people, though, who love the idea of this traditional structure, and if you can handle dealing with the insurance companies, the number of patients that you'll need to see, that may be the model for you. The second is cash pay or direct primary care, specialty care, membership model, or really any pay per visit, non-insurance type of model. Now, with this model, people like that they generally feel like they have more control over how long they can spend with patients. They don't have to deal with insurance or the billing side of medicine. But this model does take a little bit more time to bill. People typically start with a smaller patient base, and you have to really educate your patients on what the model looks like. This model is great for you if you're looking for even more autonomy than private insurance-based practice gives you, and if you're looking for flexibility in the way you practice medicine. Now, the third option is a hybrid model, and this is exactly what it sounds like. It's a mix of both. You may accept insurance for some services and then offer cash options for others. This can give you multiple streams of revenue and a lot more flexibility in how you structure your practice. It can also be a really good strategy if you're coming right out of an employed position and don't want to have to take the time to get credentialing and all those things set up. Now, there is a trade-off for this. You have to be very clear in your communication with patients and in your system so that things don't get confusing. But when done well, this model can really offer a nice balance between insurance-based and cash pay. Here's the most important thing that I want you to take from this. There is no best model. It's the model that most aligns with your lifestyle, your financial goals, and the kind of medicine you actually want to practice. But if you skip this very important first step, you can end up building a practice that looks good on paper, but doesn't actually fit the life that you're trying to lead. So before you start thinking about office space or hiring staff, or even before you start thinking of naming your practice, get clear on your model first, because this decision really does drive every other decision you'll make. And if you're still trying to figure out if private practice is even right for you right now, I created a quiz to help you get some clarity around that question. You can find that link below.